What if I told you that right now millions of youth are gambling and almost nobody sees it? Not in casinos, not at local convenience store doing scratch offs, but using the same devices for homework, talking to friends, and playing video games. Youth problem gambling and video game disorder are a growing public health crisis. Loot boxes and skin betting use the exact same psychological mechanism as a slot machine. Uncertain reward, engineered anticipation, variable ratio reinforcement. For youth whose brains are still developing impulse control, this design is especially powerful. A 2026 National Council on Problem Gambling survey found that 65% of adults reported gambling before the age of 21. Youth experiencing problem gambling at rates 2 to 4 times higher than adults. This affects every family, every school, every community. No matter your profession, there's a youth in your world who is already navigating these risks, probably without the language to name them. Here's the good news. There are things that can work to make this better. Integrating culturally responsive screening into mental and physical health care, intake for social services, equip educators, other adults, and youth with digital health literacy, and holding gaming companies accountable through smart regulations. These can interrupt the cycle of chronic acute disorder. Providing opportunities for individuals in need of treatment and support act, also known as the POINTS Act, would direct federal gaming revenue toward prevention and intervention. That bipartisan policy is in reach. The public just needs to use their voice to push it through Congress. Organizations like the Evergreen Council on Problem Gambling are already building infrastructure and prevention curricula for ages 9 to 24, as well as clinical toolkit for diverse providers dealing with youth. When we address this issue early, we can protect mental health, reduce financial harm, and give youth an opportunity for healthy development. Here's what you can do. Learn the difference between healthy play and engineered risk. Support prevention programs, advocate for the POINTS Act in Congress, and demand that platforms designed for safety, not just engagement. Remember, the 1-800-MY-RESET helpline is for anyone who's dealing with a problem with gambling or video gaming disorder, or is impacted by someone's gambling or video game disorder. Share this video and start the conversation.